From California, researchers have found a way to determine which infants are at highest risk of death from whooping cough, according to a report published in the Journal of Pediatric Infectious Diseases Society. Researchers retrospectively examined medical records of 31 pertussis patients and 5 different ICUs. They found that infants who had more severe disease had higher white blood cell counts, at least a 50% increase, than infants without severe disease. As such, researchers believe that taking early and repeated white blood cell counts can help determine the severity of the infant's infection.